This presentation has been produced to support the one-off official statistic, alcohol usage in the UK Armed Forces. The presentation provides statistics on a defence initiative to introduce an alcohol screening tool called the AUDIT and alcohol brief advice for all UK Armed Forces personnel attending a routine dental inspection from the 1st of June 2016. The data included in this presentation was collected between the 1st of June 2016 and the 31st of May 2017. Within the Ministry of Defence, there is a desire to establish a through-life process that creates a healthy culture, fosters well-being and mitigates risks to health for all its employees. As such, it is important for the Armed Forces to take responsibility for their own health, with the Ministry of Defence supporting them in making informed, healthy choices through education, leadership and service provision. This includes encouraging personnel to adopt a lifestyle which optimises their health and well-being, including a sensible approach to alcohol. An Institute of Employment Studies report on alcohol in the armed forces identified a requirement to introduce interventions to reduce the impact of excessive alcohol consumption in armed forces personnel. Public Health England and the National Institute of Clinical Excellence recommend the use of alcohol screening tools and alcohol brief interventions as tools to help reduce levels of alcohol misuse. An alcohol brief intervention is a short, evidence-based, structured conversation about alcohol consumption with a patient that seeks to motivate and support the individual to consider reducing their consumption. A Ministry of Defence alcohol screening tool and brief advice initiative was therefore implemented on the 1st of June 2016 across Defence primary healthcare dental centres as part of routine dental inspections. The dental services are delivering this intervention as they would usually see patients every 6 to 24 months, depending on each patient's recall schedule. The screening is implemented by the use of a questionnaire called the AUDIT. The AUDIT stands for the Alcohol Use Disorders Identification Test Consumption. The tool consists of 3 questions intended for rapid use in a clinical environment and was originally developed by the World Health Organization. The questions are delivered by trained dental centre staff and accompanied by brief advice and the signposting of personnel to support services where appropriate. The AUDIT has been validated in a number of settings, but this is the first large-scale use of it in a military population. The AUDIT consists of 3 questions covering frequency of drinking, typical quantity and frequency of heavy drinking. Each of these questions are scored on a scale of 0 to 4 and are then added up to give a final score between 0 and 12, where 0 indicates no alcohol use. This final score is then used to indicate the potential risk to the patient of alcohol-related harm, ranging from poor mood, accidents and reduced fitness to possible long-term illness. A score of 1 to 4 indicates that the patient is at potentially lower risk of alcohol-related harm, while a score of 5 or more indicates that the patient is potentially at increasing or higher risk. If the patient scores 10 or more, they should be given the brief advice, but also be advised on the importance of seeking further advice from their GP or a local alcohol support service. For example, 1 glass of wine contains 2 units, so if you were to have 1 glass of wine 3 times a week, you would score 3, indicating that you are potentially at lower risk. If you were to have 3 glasses of wine twice a week, you would score 5, indicating that you are potentially at increasing or higher risk. A pint of beer also contains approximately 2 units of alcohol, depending on the strength of the beer. Therefore, 3 pints of beer 5 times a week would place you in the potentially high risk category, where you should be advised to see your GP or local alcohol support service. A total of 74% of regular UK Armed Forces personnel completed the AUDIT at least once from the 1st of June 2016 to the 31st of May 2017. The results showed the following. 7% of personnel who completed the AUDIT were non-drinkers, scoring 0. 30% scored between 1 and 4, indicating that they are potentially at lower risk, while 59% scored between 5 and 9, placing them in the potentially increasing or higher risk category. 2% are potentially higher risk individuals who should be advised to see their GP with a score between 10 and 12. It is important to note that the AUDIT is not a diagnostic tool and does not give a measure of absolute or relative risk. Personnel with higher scores may not have experienced any actual harm or real health from their drinking behaviour. The Audit C also does not discriminate between occasional binge drinkers who may be at risk of accidental injury and regular heavy drinkers who could be at risk from more widespread impacts on health. A final 2% of personnel had an incomplete Audit C questionnaire. Let's now consider the groups who scored 5 or more, placing them in a potentially increasing or higher risk category. Of all males who completed the Audit C, 63% scored 5 or more, and of all females, 46% scored 5 or more. By service, 67% of Naval Service personnel, 59% of Army personnel, and 62% of RAF personnel scored 5 or more. Now considering the outcomes. 80% of personnel who scored 1 or more were given an alcohol advice leaflet, which highlights the negative effects of binge drinking and the benefits of lowering alcohol consumption. 63% of personnel who scored 5 or more were given an alcohol brief intervention to help motivate them to consider reducing their consumption. To see the full report and further information, please see the following link.